Hi guys, Dr. Nik Sethi here, and I'm here to talk a little bit about light curing. I know, boring subject. Or is it? Let's have a think and see how we can make light curing as sexy as it can be. Okay, it's not going to be that sexy, but let's do what we can. So, I once heard in a lecture that light curing is one of the most inaccurate words in dentistry. We're not actually light curing, we are light activating. What do we tell our patients when they leave our surgery after doing a composite? Well, we say, avoid eating for an hour, eat soft foods for the rest of the day, and from the next day carry on as normal. This tells us that when we shine a light, our restoration isn't complete. Otherwise, why would we ask them to take it easy? So let's have a think about the parameters that might influence whether our restoration is going to set really well or prematurely fail. Now, dentistry is hard enough. Let's make sure the blue light isn't the reason why our restoration fails. So if we think about it, what is our blue light actually doing? Well, if we go back to our university days, we know that composites have a photoinitiator, traditionally camphorquinone. Now, camphorquinone breaks down and releases free radicals when it receives light in the blue spectrum of 450 to 470 nanometers. You with me so far? I know, but come on, stay with me. Now, that means at that point, those free radicals will go through the restoration and convert and kickstart that free radical reaction to go from monomer to polymer. So therefore, modern LED light cures with single LEDs were designed, you guessed it, with that wavelength range to be perfect for camphorquinone, because LEDs only emit light of a narrow wavelength. Whereas some of the older light cure units from when I first qualified, these halogen bulbs, they may not have been so powerful, but a halogen bulb emits a wide wavelength. It's a bit like when you're driving down the motorway. You know who's got those LED lights and you know who's got an old halogen bulb because the LED light is very, very focused. You may be thinking, come on, what is the point here? Well, here is the point. If we have a look at this picture over here, the middle structure, camphorquinone, is incredibly yellow. And that's why a lot of our older composites stain and look really yellow over time because any unreacted camphorquinone will discolor our restoration. So in an effort to improve the aesthetics of our composites, manufacturers started adding different photoinitiators to improve the brilliance and the value of these restorations. But here's the problem. They actually need light of a different wavelength, from 390 possibly over to 510. So now that single LED that you might have had in your light cure for the last 10 years, you may be light curing for 20 seconds, but you might not be giving the light of the right wavelength to kickstart that free radical reaction. So you may be curing for 20 seconds, but if you're not getting the right wavelength, you may not be getting a true activation and breakdown of that photoinitiator. So it's so important to use a modern broadband wavelength curing light such as the VALO X, which will cover the whole spectrum. Now, it doesn't just have more than one LED, it contains 12 LEDs to cover the whole spectrum, and that's not the only factor. The next factor is to look at the beam collimation, meaning where is that wavelength distribution and how homogeneous is that across that whole light diameter? Because it might be that you're using a light with 2 or 3 LEDs, but can they guarantee that you're getting a perfect distribution of all of that wavelength across the whole diameter? And the answer is quite frequently no. We tested many and understood that a lot of light cure units have what we call heat spots, where you have a perfect coalescence of wavelength distribution in the middle, and on the periphery we have a range either towards the lower end or the higher end. So that means the whole surface of your restoration may not cure in a similar fashion. Whereas with the VALO, you have a really, really homogeneous wavelength distribution and beam collimation to make sure all across that surface you get a fantastic cure. Another reason why I love the VALO X is the large diameter. I used to use light cure units with a very narrow diameter of 6 or 7 millimeters. But if I'm doing an MOD composite and the average width of a molar is 10 to 11 millimeters, well, am I really curing that whole occlusal surface in one go? The answer is, of course, no, we're not. So with a VALO X, we're able to cure that whole occlusal surface in one hit, as opposed to having to split that up into several different increments. But here's where I want to just talk about a little bit on power. So a lot of modern light cure units, including the VALO X, have higher power modes. And the idea is that each increment of composite needs a certain packet of energy to set. And we know that power times time equals energy. So theoretically, if we increase the power, we can reduce the time. Makes sense mathematically. However, the truth of the matter is as wonderful as our composite restorations are, the material itself is not efficient enough to absorb that whole packet of energy in a shorter period of time. So even with a higher power, you can't get the same cure with curing for 3 or 5 seconds, which is why for me, I prefer to still light cure every increment for a full 20 seconds just to ensure that I'm not compromising with the energy for that increment. A really important issue to also discuss is access. If you're using a light cure which has a light guide at an angle, how can we ensure that if we're doing a lower right 7, that patient opens wide enough for us to get that light cure in the right spot, as we can see over here? Whereas using a flat light cure unit such as the VALO with a lens perpendicular means we can easily get access to any patient in any situation, which is incredibly important to ensure we have a good cure at all aspects of our restoration. Another important issue is the durability of these things. I know I've done it myself where I've leant over and accidentally dropped or knocked my light cure unit in the past, which had a fiber optic glass light guide, and it broke. This is a nightmare. So using something that is crafted out of a one-piece aluminium block with a sapphire lens, the VALO is almost unbreakable. Believe me, we've tried and I can't break the thing. So it's really, really useful to make sure that we have a good sturdy light cure unit in practice so that we never have an issue of something breaking. A feature that's also underlooked is testing your light cure units on a radiometer over the full 20 seconds of cure. And cheaper light cure units, and especially knockoff ones that you can buy on the internet, I've tried a few, their power is not consistent. You've got high spots and low spots of power. It jumps. So if we think back to what I said a minute ago about power times time equals energy, if our power is not consistent, neither will our energy packet be, which could affect the influence of our cure. Having a light cure unit which has a consistent power is incredibly important to make sure that we're delivering that predictable curing process day in, day out for many years. And finally, for a bit of fun, the VALO X does have some pretty cool features. You can wave it like a wand to change modes and go from the normal power to the high power. And also it has features such as a color corrected light to help you with shade taking for composites and for your ceramics. And also it has an ultraviolet mode, like a black light, that shows up where old composites are, which is really useful if you're trimming back old composite veneers for replacing or repairs. So we've said it before and I'll say it again, dentistry is hard enough. Don't let the blue light be the reason why our restoration fails. Invest in yourself in a good light curing unit with a broad band wavelength distribution, with excellent durability, solid beam collimation, even wavelength distribution, and all of these extra features that will make your daily dentistry easier, but more importantly, guarantee a better outcome and success rate for your patients over time. Let's make our adhesive dentistry more predictable. Let's get on with getting a VALO X. Thanks very much, guys. We'll see you for the next video.